Pop quiz number 76. A client's diagnosed with pyelonephritis. Which nursing action is a priority for care now? 1. Monitor hemoglobin levels. 2. Insert a urinary catheter. 3. Stress importance of long-term antibiotics. Or 4. Ensure sufficient hydration. And guys, the correct answer is 4. Ensure sufficient hydration. The worst thing you can do to the kidneys is allow that patient to be dehydrated, because the patient gets dehydrated, you're making the kidneys work even harder, and it's going to be hard on the kidneys. So you want to make sure you keep the kidneys flush. Pyelonephritis is an upper urinary tract infection. Look at the wrong answer choices. So we have 1, monitor hemoglobin levels. Hemoglobin is carried in the RBC. Hemoglobin is what carries oxygen, but we're talking about an upper urinary infection. What does that have to do with hemoglobin? Nothing. Choice 2, insert a urinary catheter. Inserting a urinary catheter can make the pyelonephritis even worse. Why? Anything that you do that's invasive, anything that's going into the patient's body, you're increasing the risk of introducing pathogens, bacteria into the patient's body, of making the infection even worse. So we don't want to do that. And then choice 3, stress the importance of long-term antibiotics. From what we're seeing, just with strictly pyelonephritis, that doesn't mean the patient's going to have to be on antibiotics for long term. Our priority right now is to make sure that the kidneys are still functioning to the highest capacity possible. So we're going to want to make sure that the patient's hydrated and we keep the kidneys flushed. Number 4 is the answer choice.